Um, well, Tina developed some complications during COVID that added significant stress to our life that ultimately resulted in her developing depression, anxiety, and truly PTSD, and ultimately suicidality. And we had tried basically everything at that point in time to try to help her. And it basically, like the Tina that I knew and we all knew, was essentially gone at that point in time. And we had tried everything conventional. They had basically convinced us that a lot of this was just the result of the medical complications that she had from the COVID vaccine. And this was going to be a new reality for us. And it seemed that this wasn't going to end well. This kept getting worse and worse. And, you know, as a physician, I'd seen situations like this many times in my career. And unfortunately, many of them didn't end well. And we weren't willing to sit back and not keep trying. And so we got to ketamine as kind of a last ditch effort. And actually, at first, I knew ketamine well, but not in this setting. Um, and at first I thought it was snake oil. It helps this, it helps that, it helps basically, from my perspective at that point, everything. And it seemed too good to be true, but I was willing to try anything. And Tina was willing to try anything at that point in time. And we decided to do it. We traveled to do it, as there's no one locally that provides it. And it was amazing. I mean, the things that they told us were medical complications of her problems started to turn around and resolve. The depression, anxiety, suicidality was improved from the very first infusion. It was an obvious cause and effect. It was obvious timing wise that this was related to the ketamine, and every infusion thereafter she got better and better, to the point that when we completed her induction, I would say she was 98% back to the Tina that we all knew. And it was as close a thing to a miracle as I had ever seen. And then we saw that same results for other people that we knew that tried it at our suggestion, and actually even some other relatives that tried it and saw the similar results. And it was too consistent for me not to notice. And the idea that I could help a subset of patients that I felt almost helpless at helping prior to that as a doctor, with a drug or a medication that I was intimately familiar with, just not in this setting, and the fact that it wasn't available in my community and it could really save lives like it truly saved my wife's life, just felt almost like a calling. And so I decided that I was going to come out of retirement, which I honestly was enjoying, but I was going to come out of retirement and decided to go get some extra training in using ketamine in this setting. I got certified in it. And Tina and I decided to open one more business together, and that's how Relevate was born.